Good morning, everyone. My name is Aetna Daly, and I'm the marketing coordinator here at AIM. Before we begin today's webinar, I wanted to take a moment to introduce a new LTC tool that we've been working on at AIM. So we're always looking to develop new channels to give our agents ideas and tips you can use to sell, and a great channel we want to utilize is social media, specifically Facebook. So we have created an exclusive LTC Facebook group where I, along with AIM's marketing team, post tools pretty much daily that you can use to grow your long-term care business. To join the group, all you have to do is visit facebook.com/groups/LTCI Sales Forum and click join. After that, you should be approved to join pretty quickly by either myself or the marketing team, since this group is pretty heavily monitored throughout the day. After you've joined, we highly encourage you to post any ideas or questions you have in the group. This is a great way for you to communicate with AIM's marketing team as well as other agents on the new platform, and we really want to make this as interactive as possible. We're excited about this because it opens up a new line of communication, and it's a tool you can use to get quick answers and new ideas. So if you have any questions about joining the group, you can always give me a call at the AIM office. And again, my name is Aetna. So with that, I'm going to go ahead and turn this over to Mike and Anthony for the webinar.
Morning, everybody. Wanted to just take a quick minute here while we're getting Anthony set up to present for us. Just some reminders, we are in lecture mode, and that's so that we're able to give you a high quality recording. This will be recorded. It will be archived and uploaded on our website probably later here this morning or first thing this afternoon. We will take questions at the end, which is also one of the things that we do here so that we have good, consistent quality. As a reminder, and I'll remind this again at the end, when we get to the end, if you're not going to ask any questions when we go to the Q&A at the end, if you wouldn't mind muting yourself, that would be helpful. That way we don't have tea kettles whistling and dogs barking and things like that going on in the background. So what we're going to do here, Anthony's going to take the GTL product and kind of give you the overview look on that, because there are 3 different pricing bases for that product. We're not going to get much into pricing. We're just going to talk about features, and then I will give you an overview look of Aetna's recovery care, and again, not about pricing so much as the features, and then we will leave you with that, give you the opportunity. We can certainly get you contracted and get you set up with these. Just as a general overview note, not unfamiliar for those of you that have been around on our webinars and with these products and the state regulatory situation. New York, Washington, California, and Florida, all lifetime members of the Axis of Evil. None of those states have approved these products. And as such, if that's your primary location, probably not going to be very helpful. We do try to broadcast out to folks regardless of state of residency, because so many agents are now working cross borders as a result of their ability to make use of the internet. So with that, I'm going to get out of the way, and Anthony's going to take over here and take you through the GTL product. So take it away, Anthony.
Good morning, everyone. A lot of time we always wonder why short-term home health care. Let's just say if you suffer from an illness or an accident, the very last place you'd want to recover is an unfamiliar environment like a nursing home or even a hospital. We would love to all focus on our recovery in the comfort of our own home, and that goes for most anybody. Think about your own family member as for a scenario for a second. Depending on your age, many of your family members are within the age of where they're planning for their future care as being a necessity. Or let's just say your parents keep reminding you that they do not want to be in a nursing home. They actually would love to be at home, getting care at home, nowhere near a nursing home or even a facility. How could being unprepared affect your finances and or their way of life? Here's a little statistic. The national average for a nursing home is about $97,455. And even for an assisted living facility, it's about $45,000. GTL has some of the most affordable plans and they can keep their policies, tailored to the way they would want. What's nice about GTL is they pay their policyholders directly, regardless of any other insurance you have. Home healthcare benefits kick in if you suffer from either a cognitive disability or cannot perform 2 of the 6 ADLs, just as a long-term care policy would. What's a kicker in this is there is no hospital stay required to receive benefits. The plan it consists of 3 major components. That is home healthcare benefit, which would be this main part right here, your short-term home health care aid benefit, which is right here, and your prescription drug plan. Within your home health care aid benefit, your home health care benefit itself, you have between 3 plans. You can either receive a plan of Plan A, Plan B, or Plan C. The daily maximum benefit for a Plan A is $150 a day. Plan B would be $300 a day, and Plan C would be about $400 a day. These variety of services are broken down into what each would cover. So like a skilled nurse, an RN, if you had a Plan A, which would have the maximum benefit of $150, you'd receive $75 for that care. Plan B, $150, or Plan C, $200. What's nice about this plan is to keep it simple. If, let's say, your cost of care and you had a Plan C was about $125, GTL will pay $200 regardless of what the amount of the cost of care was. With our most comprehensive plan, which would be the Plan C, you can receive up to $162,000 of home health care benefits. With our home health care aid benefit, you can receive a daily amount due to which plan you select, and that can range anywhere between $40, $80, or $120 per day. Now, just to keep in mind, the maximum benefit period for the short-term home health care aid is 60 days. Here's one more statistic for you. 90% of Americans over the age of 65 have taken at least one prescription in the past 30 days. What's nice is the fact that we have the prescription drug plan benefit as well into this. GTL will pay a benefit amount of $10 for each generic or $25 for each brand name prescription, up to a policy year maximum of $300 for Plan A, $600 for Plan B, or $600 as well for Plan C. So how does it work, I guess you may ask? Let's use an example. Let's say you're 65 years old and you get a Plan A, which will cover up to $300. You refill your brand name prescription for 10 times. That's 10 times 25 because you get $25 per each brand name prescription you use. GTL will pay you $250 for that prescription benefit for that annual year. Your annual premium for having a Plan A would be about $294 or $294. That would make about a net policy amount for about $3.70 a month, which is crazy. It doesn't even include the home healthcare benefit or the home healthcare aid benefit. So it kind of puts into perspective on how important these benefits are and how they coincide with cost. One nice added benefit to this policy itself, policyholders receive access to Ask Mayo Clinic, which is a 24-hour service. They will handle all medical questions, and they even have web-based symptom assessment tools. That will be down here to access your Ask Mayo online. Select the symptom, answer the symptom-specific questions, receive care guidance. Pretty neat. Now, the biggest question, it seems too good to be real. A lot of people always mention home health care. It sounds too good. Well, the next question they always ask is, how's the underwriting? The underwriting must be hard to get through. There's no way you can get this good of a product that easy. Well, I'm here to tell you that with GTL's underwriting, there are no medical exams, and the app is just really easy to write. There's only 3 pre-qualification medical information. It'll ask you, is the applicant currently in a nursing home / assisted living facility or receiving home health care or similar types of benefits? Check yes or no. Is the applicant unable to perform routine ADLs, active or activities of daily living, whether it being any one of those, or being cognitive impaired? If you have the option C, in the next 60 days, does the applicant expect to be admitted into a hospital or nursing home, assisted living facility, or required home healthcare services, or have surgery? It's as simple as that. Those are the only 3 questions that they ask. And it's a pretty easy sell. Now, as to that, I'm going to hand it over to Mike, and Mike is going to give us a look at Aetna's product.
All right. Thanks, Anthony. Appreciate it. I'm going to switch us over here to me. Present. So I'm going to take a look at the recovery care product from Aetna. Before just going to run, Anthony's going to mute himself here, but going to run over just a couple of generalized things. And if you've been on my webinars, you've heard me talk about these types of things a lot. The nice part about this entire portfolio of short-term home care products is that they help you. It's another way that you can address this kind of split deal where it's your agenda and your client's agenda. All right, because agents want to make sales. We've had agents express a lot of frustration over a lot of years about the theoretical difficulty with, I suppose I ought to, oh, there we are, we're set to go. The theoretical difficulty with traditional long-term care. So we get that. But along the way, things have evolved, things have come about that have enabled you to be able to address some of those complaints and still take care of your clients. Very, very important to note. And if you've paid any attention to the webinars I've done along the way, you've heard me say this repeatedly. 90% of the people in the workforce and who are retired in this country have not had a conversation about solving the long-term care problem. They haven't had a conversation with an agent such as yourself about how to protect their version of the American dream. So you've got some ways that you can do that. So now, with that said, sort of as a stage setter for the conversation here and the overview look at the recovery care product, it offers more pieces. You got more moving parts here. You got more benefit available while you're still staying out of the quote unquote traditional long-term care space. All right, but I will tell you that because you got more benefit available, you're going to see more underwriting pieces that you're going to have to deal with here. It isn't just going to be one medical qualifying piece. The nice part is because so many of the states where this product is available, the GTL product is available as well. If you've got somebody that you think is in decent shape health-wise, you can use both of them together. And if they aren't going to qualify for the Aetna product by virtue of something that we come up with or that you come up with from an underwriting standpoint, because of how GTL is set up, if they're not cognitively impaired, you're going to be able to get them the product. So, all right, so plan benefits here for recovery care. As you can see, it incorporates both nursing facility and assisted living along with home care. All right, you can get up to $300 a day. You got a lot of different benefit periods here, 90, 180, 270, or 360. And you have a lifetime max that's equal to twice the covered number of days or number of covered days. Okay, so you've got some different levels of flexibility. Issue ages are really, really strong at 50 to 89. One of the pieces that you bring into play here that you don't have with the short-term care product from GTL is the waiting period. You are introducing an elimination period. This is going to pay for somebody who's confined in a facility situation. Again, the triggers are the 280Ls or the cognitive impairment. There isn't a requirement they have been in a hospital stay prior to. A lot of other nifty things, the bed reservation coverage, as you can see. Now, you've got to have at least one unit, $10 per day, of the hospital indemnity product piece of this to bring on the nursing facility benefit. So you are getting into a little bit different level of complexity and a much higher number of moving parts, but still a great opportunity to address that idea of their agenda and your agenda. And as our old general manager used to say repeatedly, it puts you in a position to be able to help more people going forward. Home care rider optional home care rider is optional, also available. Oops, get back to that thing. I hate this deal. As you can see, there's a maximum of $1,200 per week, so it's a little bit lower level of coverage, but that's a trade-off to pick up the opportunity to have some facility coverage as well. You can go as long as 1 year, and that benefit is available anytime that they get 3 or more professional home care service visits in a week. So it's a little bit different in terms of how you manage it. And really what it comes down to is they're nudging them a little bit more towards having professional services or paid services rather than the informal services there. Standard provisions apply as far as filing claims, submitting bills, those types of things to be able to get the payments on this taken care of. Taking a look here at underwriting, as I said before, a little bit different breed of cat, a little more complex because you have these additional benefits available. I know because of the nature of how the webinar system works that it's a little bit difficult to read this, but this is as big as I can make it and still have everything on the screen. So, all right, so at the top, you have the checkoffs. This is what we see on any of these short-term care situations where they're basically asking, are you on claim and are you sure you're not on claim? They want to make sure you're not ADL deficient, okay? You move into section 2, within the last 3 years, they want to know specifically about cardiovascular issues, cancer, Alzheimer's or dementia, and AIDS, age-related complex, etc. After that, it's a little bit more generalized set of questions here. They want to know about oxygen use, if it's been required. Have there been any, specifically any questions with regard to TIA, CVA, or stroke? Any multiple hospitalizations, respiratory situations. So they're getting into a little bit more detail than what we've seen in the past in this space. And are they having issues with mental or nervous disorders? They do dig very specifically into diabetes, as you can see. 50 or more units of insulin is almost for sure going to be a disqualifier. That's pretty much the case in all the different parts of the more traditional space. Complications from diabetes, and are there any cardiovascular heart disorder issues? That's become something that the industry has realized is a significant problem. They want to know whether there's any sort of testing, specialist referrals, things like that haven't been followed up on. And is there anything that hasn't been culminated that's already been underway? And they want to know about even something as specific as joint replacement. Okay, and then they do also get into alcohol or drug abuse. So as I said at the beginning, you got a much wider swath of benefits available with the facility benefits on this, and as such, you're going to have a higher level of underwriting involvement with this piece. So with that said, and kind of a split 10-minute overview on both of these, going to go ahead and switch, take questions that folks might have about these. Again, we don't want to get into product specific, or not product specific, I'm sorry, but case specific questions. you can call in and talk to one of our marketers to review a particular case. We're going to need to have folks do the appointment paperwork before we're able to release the materials out on this, so that we're able to properly position agents to be able to talk to folks about this. And this will give you an opportunity to you can close 2020 strong if you want, simply by having the conversation. And that probably brings up probably the most important point is this is not going to sell itself. Neither one of these will. If you start having conversations with prospects, existing clients, folks that you know, et cetera, you will make sales with this product, because you're going to be the only person who's asking them about this. So, all right, we're going to take a minute here. I got that's a specific question. It's a hypothetical question, so we'll skip away from that. Going to go ahead and unmute folks. As we always say, if you've got a situation where you're not going to be asking questions, if you wouldn't mind self-muting yourself, it does make it easier for us to kind of manage the noise and background information, et cetera. So, all right. Anybody with questions out there, please feel free to fire away.
Yeah, if this is Jim in Colorado Springs.
Yes, sir.
If you have sleep apnea and you have the CPAP machine and you're on O2,
Okay.
Will that disqualify?
But which product? We're talking about two products here.
Okay, the one we were just discussing.
Aetna. Okay.
Aetna, right.
Well, my take on that would be, because it is oxygen use, I mean, it doesn't tell you that specifically you're going to be rejected. Background noise here. That are having sales calls and such. Apologize for all the background noise. Let's take a quick look here. Yeah, because of the Section 3 notation here in the past 24 months with regard to oxygen, yes, that would be a decline for the Aetna product. That would push you back towards the GTL product. Any other questions? Had to mute a couple folks. Sorry about that. Background noise and such. Okay, well, we still keep having background noise, trying to get it open for questions. Anybody else with questions? Again, we will get this converted and uploaded to our website. Should be early afternoon, maybe even late morning here, depending on how quick we can get to it. So you will have it available to circle back to and review. So other than that one question from Jim, thanks for that, Jim. We appreciate it. Doesn't look like we've got anything else. So one last call for questions before we go ahead and wind things up. Okay, well, that said, we're going to go ahead and wrap it up. We do appreciate everybody making their time available. Thank you so much for that. See here, next webinar next week is Dial It Down, which is my soliloquy on how to use the different inflation options that the Mutual of Omaha product has to help you make more sales. So we're going to circle back to close the year in the traditional space. So, all right, we're going to go ahead and wrap. Thanks, everybody. Appreciate you making your time available to join us here this morning. We'll have this converted and onto the website here very, very soon. Anthony, thanks. Eliana, thanks. We'll talk to you again soon, folks. Bye now.